The support health practitioners to reduce the stigma associated with seeking support for their own mental health. So I was going to that sort of budget line.
Yeah.
Where I'd be interested is the breadth of the definition of health practitioner and whether that includes paramedics.
Yes, it would. So there are some specific initiatives. So we're supporting the Every Doctor, Every Setting initiative developed by the AMA. So that's essentially to implement and evaluate strategies for depression and anxiety in the workplace, school and education healthcare settings for medical professionals and students. There's to continue the funding for the Essential Network, which was developed last year to support all health workers during COVID, so that would include paramedics. There's funding to evaluate the mental health and wellbeing services targeted at health professionals, health practitioners, I should say. And the other element is to continue the Doctors for Doctors service for 3 years, which is essentially doctors supporting other doctors with their own mental health concerns. But paramedics would have access to the Essential Network, bearing in mind, of course, they are state and territory government employees, and state and territory governments would also have mental health supports in place for them.
Yes, I'd take issue with that distinction because there's various, as I understand across the country, various levels of health support for paramedics,
Sure.
first responders. Some are good in some states, some are bad. So I'm just interested to try to tease out where the Commonwealth can assist the individual as a citizen of the Commonwealth as opposed to just having to rely on their own state. So
certainly.
sort of coming with my questioning.
Yeah, certainly through the Essential Network developed by the Black Dog Institute that provides support.
Let's go to sort of the collective suicide prevention initiatives, and I did raise some questions last time. Have there been any changes to involve paramedic community or first responders community into this number of initiatives? I mean, I appreciate the response is they're employed by the state, but there are a lot of people employed by the state that also get the benefit of these, and they are a particular cadre in the community which are increasingly under the most stress. So my question comes from a perspective of paramedics, for example, are nationally registered now. They have some nexus to the Commonwealth. The Commonwealth has sought out certain groups of cadres which may be under particular stress. This is a cadre, regardless of whether employed by the state, that have a particular profession that makes them vulnerable for PTSD or other ailments. So just interested out of the initiatives whether we've covered off on their particular stresses in their profession.
Yes, so there are a number of initiatives in the suicide prevention pillar in the budget, Senator, which will be negotiated with states and territories to jointly fund. And one of those is to expand the definition of aftercare. So at the moment there's a large program through the Way Back, which is also being expanded to pilot referrals for anyone who may have made a suicide attempt but not actually made it to hospital. So that expands that group specifically. There's also a trial of distress intervention, which is very based on a model in Scotland. So that's seeking where someone comes into contact with a service provider, they're then referred on immediately, well, within 24 hours to support. So if paramedics were in those groups, and obviously as you've correctly identified, they're in a highly stressful workplace. And so if they're dealing with other services or other parts of the service system, they're able to be referred on to support potentially through those trials. So that we'll be working with the states and territories this year to finalise the details of those trials.
Just having difficulty with the concept of they may well be state employees and they may have particular programs, but the Commonwealth is investing in a variety of ways, very positively, with different cadres of individual. And it seems to be shying away from dealing with this as a particular cadre, leaving aside the excellent response post bushfires. But that was tasked, that investment in particular to that difficult time. And can you envisage this cadre of individuals coming within the realm of the focus of the Health Department?
So I think Senator, one of the things that we do, and we work very closely, as Mr Rodham outlined, with the states and territories to make sure that we've got a comprehensive mental health system and a reform system. One of the big findings out of the Productivity Commission report was looking at how we better work with states and territories and integrate that system. The states and territories are responsible for providing the right training and the right supports in the workplace for their employees. But obviously the programs that we've outlined really try to cover front responders and making sure that they have the best training in providing mental health first aid and trauma-informed care, but also have the supports available to them. And I hasten to add the supports available through the digital health systems, the MBS systems, and all the other systems are available to all Australians.
Thank you.